exactly what happens in a hospital, and as I say, I got the most brilliant treatment. Anyway, we're going to continue the NHS theme on Cross Questions. It's a sort of special NHS edition, seeing it as it is the 75th anniversary. Joining me in the studio to answer your questions, and I do want them all to be at least vaguely related to health. Sir Norman Lamb is chair of South London and Maudsley NHS Trust, former Liberal Democrat MP and Health Minister. Dr Kieran Mullen is here, Conservative MP for Crewe and Nantwich and a former A&E doctor. Sarah Gorton is head of health for Unison, the UK's largest trade union. And Judith Woods is a columnist for the Daily Telegraph, who wrote an article last year titled "The 49 Hours That Killed My Faith in the NHS." So you're going to get a diversity of opinion over the course of the next hour, I can assure you. The number to call 0345 6060 973. You can text 84850 or say, Alexa, send a comment to LBC. You might want to comment on what we were talking about in the last hour about Tony Blair calling for an increased role for the private sector in the NHS. The boss of St Bart's Hospital in London telling LBC that morale among NHS staff is at an all-time low, and NHS waiting lists being at a record high despite the Prime Minister's pledge to cut them.
Call 0345 6060 973. Tweet at LBC. Text 84850. Cross Question with Ian Dale. This is LBC.
Right, let's go to our first caller. It's Dominic in Northwich in Cheshire. Hello, Dominic.
Hello. My question follows on from your question. Should the NHS be privatised? Should the NHS be renationalised from its current state? So no private sector involvement anymore. So no agency staff, no private catering, no facilities management, no private procurement. Just all brought in house and renationalised as a national health service.
Nationalise pharmacists. All dentists?
Potentially. So there would be no need for reimbursement for pharmacists from private pharmaceutical companies. The NHS could use its bulk purchasing power to get better deals on medicines. So bring in the pharmacists in-house as well, bring the dentists in-house, bring all of the services that were like facilities management, which Tony Blair privatised through private financing.
Okay, right.
PFI, etc. Make it all national and nationalised as a national health service.
Right.
Should that happen?
Okay. Thank you, Dominic. Let's go to Sarah Gorton from Unison. Now, I suspect, Sarah, that even that would be a little bit too far for you.
Well, I think when you look at the fragmented nature of the way that the whole health and care service is provided, it's certainly a big stretch, isn't it? And thinking about all of those different areas, so not just the areas you've mentioned like dentistry and pharmacy, but actually general practice, the whole way into the NHS for many people is currently not run on those same models. I think one of the issues that we do have to address is about the impact that fragmentation has. And most of us walking into a hospital or health centre just see people and don't realise that masks quite a range of difference in the way that people are employed, not just different contracts within the NHS, but some people work completely for different companies. Some people, as your caller said, work for outsourced catering providers. So that does create its own complexities. I think in terms of the challenges facing the NHS, and again, thank you, Mr. Blair, for the stunning report. That if you read his report,
was that said with a degree of sarcasm?
Was intendedly sarcastic, because if you read the report,
sure.
the answer, there isn't really an answer in there that's linked to privatisation. It's all about having an app that will suddenly fix everything, which actually is very far from the practical suggestions that can help. So I think a massive stretch, a really good call, just in terms of flagging up the different layers of different range of provision. I think the biggest gap at the moment is when you look at the different approach that's taken in social care and the impact that has had. And, we're seeing through the COVID inquiry the difference that led to, in not just in the way that had outcomes for individuals, but the way that the NHS was able to respond as a system to that a hugely unforeseen problem and the pandemic suddenly landing. But the way that social care is structured just meant that was absolutely impossible. And you ended up leaving people running care homes, making decisions and implementing draconian rulings from the centre without any ability to be able to feed back and feed up those issues.
Norman Lamb, do you think that we're too obsessed with structures here about sort of whether something's private, public, or whatever?
Yes, totally. I think what matters is the quality of the care you get. And I think actually if you look back to the period of pretty high levels of satisfaction with the NHS under the Blair government, he embraced the role of the private sector. And I don't have a difficulty with that, provided they're providing good care at the same price as the NHS. A year or two ago, I had a hernia operation under the NHS. I happened to be referred to a private hospital. And I think it's actually rather an attractive proposition, the idea that anyone, regardless of their ability to pay, the poorest person in the country can end up in a private hospital, paid for by the NHS, getting good quality care. So I don't have a difficulty with that. And I think if we're to overcome the massive challenges that the NHS faces, and, let's be honest, there are too many people experiencing failures of care at the moment. The whole system is massively overstretched. Brilliant staff are stretched to the very limit. We will have to have a collaboration between private and public. And, think about technology. The idea that the state can do all the innovation in technology that will be absolutely necessary to overcome some of the inefficiencies within the system is for the birds. So let's just focus on the quality of care. Let's not worry about who provides it. And let's also focus on access. And for me, equality of access, so that whoever you are, whether you have no money at all or whether you're a millionaire, you get the same access free at the point of need. That's the important principle for me.
Judith.
Well, every time I hear the word NHS these days, I think of the Hovis music and maybe Call the Midwife and lachrymose sentimentality, as though the NHS were a person. And so any criticism of the NHS is conflated with, I hate doctors, I want to kill nurses. There is no adult debate being had
I agree with that.
Anywhere. And you always have to, was it Nigel Lawson who said it was the
National
religion.
Yeah.
And it's true, and it's heresy to admit the truth, which is it's letting too many people down too much of the time.
But isn't it refreshing that we have a shadow health secretary in West Streeting who would agree with you?
Yeah.
I mean, he said in an interview last week, it is not world beating, it is not the envy of the world, and it is not a religion. And I thought I would never hear that sort of thing from a Labour shadow
And he's
health
also
secretary.
prepared to put the patient first.
Yeah.
I get that, but I have been writing about this for about 20 years. So it's pledges are great. Pledges look great. Let's get in lots of new doctors when the doctors we have already are striking, because some of them, not many, but about 11% junior doctors are paid less than a barista. That's not going to solve the problem of infrastructure or hospitals that are falling apart or hospitals that rely on fax machines, photocopiers, and there's no joined-up thinking. And my sister is a French citizen. She's lived there for a long time. She cannot get over the craven gratitude I express when I get an appointment the same day with my GP, even though the whole family is up and we've all got our mobiles, and it's like getting tickets for Glastonbury. Well, who's going to get through? Who's going to get through? And I pay for the NHS. We all do. There seems to be this disconnect between it's free at the point of service, but we are paying for it with our taxes. We are paying for a service where there is a 7 million long waiting list.
I mean, clearly you're not going to agree that the NHS should be nationalised, which was Dominic's question, but do you think that there should be much more private sector involvement in the NHS, and do you think you would get a better service if there were?
3 words: accountability, accountability, accountability. At the minute, it's a behemoth where I've had many very unfortunate encounters. I've had meetings with trusts. I've had meetings where the trusts brought their lawyers, and learnings were not made. There is no accountability, because I have been in a situation where...
And you saw that as a constituency MP, didn't you?
I did, yeah. And the culture in large parts of the NHS is not good. Whistleblowers who often risk everything get treated very badly a lot of the time. I supported a very impressive junior doctor called Dr. Chris Day, and his career has been ruined by taking the risk of blowing the whistle on understaffing. So, I agree about accountability. It's got to change.
Now, Kieran, you've worked at the sharp end in the NHS. You're now a constituency MP.
Yes.
I imagine you got some interesting views from both aspects here. I'm going to take it that you won't agree with Dominic's question about should the NHS be nationalised as such. But in terms of structures, when you were working as a doctor, I mean, do you still?
Not recently. I did some volunteering during the pandemic a couple of times, but not since then.
But from your experience working in hospitals, with actually really little power to influence things, now you're in a position where you can influence things. Have your views changed?
I'm going to start, and Judith won't like this, I'm going to start by saying I think it's really great actually that we're all using this anniversary as an opportunity to talk about and debate the NHS and how we can improve it, because it does play a huge part in all of our lives, and I think most of us are grateful for positive experiences and the staff that work there. I think this discussion really brings to mind, and I agree with some of what people have said, that first of all we talk about the NHS as if it's a universal service in terms of the quality of care and the people working in it, and I don't even find a single hospital as a uniform experience. Within a hospital there'll be really great departments, some departments that don't work as well as they should, and you can just apply that across the NHS, and I don't think there's any single silver bullet to tackle that. And whether it's less or more privatisation, less or more central control, there isn't an easy answer to any of the challenges, because you're talking about a complex organisation doing complex stuff with lots of different people, and there's no easy way to fix that. I think the biggest challenge we have to come to grips with as politicians and the public is actually, I think, one of resources more than anything else. That with an ageing population, every year that goes by, if we want to keep quality of care at roughly the same level, you actually have to spend more, and that is just something we have struggled to get to grips with, not just in the UK but across the Western world. And you see spending creep up, but I'm not sure the public are ready to see that creep up and up and up. And I think there's a bit of a tension between, we say that we want the NHS to be the best in the world, and in some ways it is and could be improved further, but are we willing to fund it, at quite that same level?
But I mean, it always comes back to money here, but we're already spending £1 in £6 the government spends on the NHS. Yes. Now, I asked the question in the last hour, well, how much more would people stomach?
So that's the common refrain when you bring that up, and I certainly think there's a genuine debate to be had about how much we spend on the NHS versus other important public services, whether that be schools, the justice system, police. But if you're talking about keeping it at the same standard, if it was the most efficient service in the world and you didn't do anything differently, you would still need to spend more as time went on, because we age, and every year that the population ages, there are more people living longer. People that are in retired households use roughly twice the amount of resources in the NHS in non-retired households. So every year we have more and more retired households, and that's not going to change. We can tackle that in a resource way by, as we do, asking people to retire later, so there's more money coming into the system, but you still need to spend more if you want the same service. And the common misconception is, well, if we prevent more ill health, we can save money that way. All that ever does is shift this expenditure to a further date down the line, because all of us eventually get ill with something that needs NHS treatment, and the longer we live older lives, the more likely we're to be living with multiple conditions, and actually the better we get at treating people, the more we have these extra conditions that we carry with us, which still cost money to treat.
That's not a reason not to focus more on prevention, though.
Absolutely not.
We do need to do
Yes, absolutely not. And the example I use is heart attacks. 20, 30 years ago, if you had a heart attack out on the street, your chances of survival were very poor, and now you're much more likely to survive, and that's a fantastic thing, and we all welcome that. But it also means we have more and more people living with damaged hearts that decline over time, that need expenditure. So my argument is not to say we don't do that, but but it's to say that we have to really engage the public with this idea of an ageing population and politicians of all parties, that it's not like other public services where you can expect things to stay even if you do everything right. If you do everything right, you can expect it to keep going up because you're just helping people to live longer with health problems.
Right, we'll move on in just a moment. Do keep your calls coming. 0345 6060 973. We're only taking calls on the issue of the NHS and health in general. It's 8:17.
This is LBC. Cross Question with Ian Dale on LBC.
19 minutes past 8 on LBC. Sir Norman Lamb is with us. Dr. Kieran Mullen, Conservative MP for Crewe and Nantwich, former A&E doctor. Sarah Galton is Head of Health for Unison, the UK's largest trade union, and Judith Woods is a columnist for the Daily Telegraph. Right, next question is from Chris in Richmond. Hello, Chris.
Hello, Ian. Hello, panel. Do the panel agree with me that mental health services remain the Cinderella part of the NHS? And if so, why?
Well, let's go to the chairman of a mental health trust, Norman Lamb.
Thanks for raising this, Chris. I appreciate it. Yes, the answer is the answer. And I feel really frustrated because I sense that over several years we were getting into a better position. There was an increased focus on mental health. There was the whole Time to Change campaign where people were coming out and talking about their own mental health. And politicians were responding. There was more money going in. And I include Theresa May in that, incidentally. She had a real commitment to mental health. But there is no doubt that the focus has slipped of late. And for me, it just looks like a focus on getting waiting lists to acute hospitals down before the election, improving access to GP surgeries, and I don't hear much talk about mental health. And yet, if you look at what's going on in mental health, it's pretty dire. We have people still shunted all over the country in search of a bed. That's a wholly unacceptable practice, but it carries on everywhere. We have waiting lists that are, you could be a teenager waiting a year to start treatment. That doesn't just affect your health, but it affects your education as well. So there are lifelong consequences to that neglect. We're seeing a reduced focus on mental health at the same time as there's been a massive surge in the prevalence of mental health. The pandemic has had a psychological fallout. We know that, particularly amongst young people. And then you have the cost of living crisis on top of that. and you have so many households in financial stress. And I was talking to a liaison worker today who works in A&E, and they were saying that they are seeing more people with talking about money problems arriving in crisis in A&E. So there are consequences to this, health consequences. And, you know, CAMHS, children's mental health, is the fastest growing specialty of any in the NHS. And where do we see a focus from government on that? It's just not happening. And so it just results in so many families being badly failed across the country, including in our capital city. And, you know, I hear constantly of people getting stuck in A&E in the middle of a crisis. They can't get access to a bed. The whole system is under impossible strain. And for me, this is not acceptable. Whoever's in power. I think there's, incidentally, a really important challenge for mental health to reform the way it works, to move away from institutionalisation of people in mental health hospitals to support people more effectively in the community. There's a lot we can do to use the money more effectively, to be more ambitious for people's lives. But the bottom line is it needs a focus nationally, and I don't think it's there at the moment.
And is that predominantly because of money pressures, or is it just an attitudinal issue?
I feel it's an attitudinal issue. I feel that you need champions in government who will fight the corner for mental health. I tried to do that when I was minister. As I said, I want to be fair to Theresa May, because she, I think on her speech when she became Prime Minister, she mentioned mental health. We haven't heard that since then.
Judith Woods.
Well, I wrote recently about the 125,000 children, teenagers missing from the school rolls since lockdown, since the pandemic. And I think it's a fair bet. There's an awful lot of mental health issues going on there. Yeah. I know from personal experience, I've got a friend who actually went to the GP and cried after 2 years when her daughter was in bed, didn't leave the house, and said, you know, sometimes I wish she had cancer, because if she had cancer, somebody would care. How bad is that? Another person I know said, oh, well, we're quite lucky because she was diagnosed with anorexia. That meant we could get her mental health sorted out as well, because there are pathways for that. There's an entire generation of young people languishing. And as I know from my local CAMHS, you only really get seen if you punch someone or you attempt to take your own life. Common or garden vanilla self-harm isn't really registering because the resources are so thinly stretched, and it's appalling. And someone like, you're only as passionate as the experience you've had, and so someone else will talk about something else. But I find myself feeling very betrayed by a system where a child has to have passed all reason to be seen by anyone.
Kieran.
Yeah, I don't dispute that there are challenges when it comes to accessing mental health services. I mean, I have to say in this area, I try to talk as much about mental well-being as mental health, because in terms of what we've seen the biggest increase in, I think it is, in the same way we have physical health, we want people to be fit and healthy to avoid getting more acute illnesses. I think it's also true with mental health, that I think if we did a better job of supporting particularly young people when it comes to resilience, social well-being, and which has been the government's focus, particularly with schools. So the plan is that each school can have someone that can support children. I think we'd see less people further down the line with more serious problems that develop over time and need a clinician's involvement as a specialist.
I mean, that is certainly something that needs to be done, because somebody I know was working in a school, had no qualifications on mental health, but just was expected to handle really serious cases with children. And in the end, she had to leave the school because it was doing her own mental health thing, because she knew she wasn't qualified to do it. She was doing her best. Yeah. But you've got to have people who have some sort of training. Yeah,
no, and I think related to that, I do welcome, there's a similar focus, recognising that some of these issues social, as Norm mentioned, factors, that the social prescribing stuff is really taking off. So that one of the reasons I moved from medicine to politics is that during my time in GP shadowing, you would often see people who come to see you really about a social issue, or they had a mental well-being issue that was because of social causes. It might just be that they're very, very lonely. And we didn't really know as the NHS how to deal with that. And we have begun to learn that actually there are programs that you can send people to local groups so they can not be quite so lonely. If you have a parent that's struggling when it comes to bringing up their children, something else I saw, there are parenting groups that they might be referred to. So I think we're getting better at tackling those issues, but the scale of it isn't quite where we need it to be.
Why do you think it is, or maybe you don't think it is, but as Norman said, why has mental health slipped down the political agenda?
I think what Norman said is slightly overstated. The stuff that we're doing, particularly, the really, really important workforce announcements last year about really expanding the health workforce in primary care, medical schools, nursing, pretty much doubling all of those. Mental health benefits from those too. Some of those new GPs will be GPs with a special interest in mental health. Some of the new doctors will go on to be psychiatrists. Some of the new nurses will work in mental health. So I think some of the stuff we're doing generally to support the NHS, and as I said, that really groundbreaking plan that we've announced recently around the workforce will benefit mental health too. But I think it's true to say when there's a really, we've had COVID, which whilst it created a mental well-being challenge, also created huge backlogs when it comes to physical health. People want those physical health demands met as well, and there's only a limited budget and it has to get divvied up somehow.
Sarah Gordon from Unison.
Well, we've had this conflation of two big issues, haven't we? We've had the thresholds at which you have to have, at which you can get intervention being ever raised. So you have to be in worse crisis before you get access to services. And we've had cost of living crisis plus pandemic, which we know has added to the to the range of crisis situations that people are in. I think you talked about the issues that this places, the pressure it places on other parts of the services, and ambulance services. Or you've been talking to lots of ambulance workers today and over the last few months about the pressures on emergency services, and that's where this ends up. When people in crisis are not treated or are only treated at crisis point rather than having access to services earlier, with the ambulance service, with police ending up not dealing with what they should be dealing with, but ending up dealing with the mental health patients that can't be seen through other routes. I think one of the links between this and staff is that it's an issue for everybody accessing all types of service, because it's the biggest cause of staff absence in the NHS as well. So people who work in the service can't also get access to treatment, and that means fewer people all round. I think the other aspect of the service that I would point out is that mental health services have to be delivered kindly and with compassion too. And the more overstretched people are, dealing with people in crisis is more difficult when you are overstretched. So take an already overstretched mental health service, add staff absences in, add loads of agency staff being on the wards as well, and you end up with a system where you've got fewer people treating more people in a worse state of crisis.
And is that something, Norman, that you kind of have to deal with on a day-to-day basis? You're always firefighting.
Yeah, we've got brilliant staff who are working under constant strain. It feels like a constant crisis, a sort of revolving door of crisis. But I do just want to give a shout out to the innovation that's also happening. This afternoon I visited the Mulberry Hub in Lewisham, which is a primary care service led by a brilliant GP supporting young people in Lewisham from quite disadvantaged backgrounds. And the work they are doing in seeing people, supporting people much earlier on, stopping the deterioration of health in the first place, that's what we should be doing. And that's how... that's why I say there is a responsibility on us in the mental health system to reform how we behave. And actually, it's an example of where prevention does save money. if you prevent someone's deterioration of health, if you keep them well in the community, prevent people falling into crisis and getting detained under the Mental Health Act, you preserve their dignity, but you also save a load of money that is instead used on effectively containing someone in a locked ward. That is not ambitious for people's health. And this great innovation that we see happening in our organisation and elsewhere, that's what we should celebrate. And we need to somehow accelerate that within the NHS and get the NHS to be braver at being willing to try new things and investing in new ways of doing things. Because if we keep doing the same thing, we'll keep getting the same answers and it will fail people, just as we've heard from Judith.
Well, Chris, I hope you felt we've dealt with your question well. Thank you very much indeed for it. We'll come to more of your questions in just a moment. You're listening to LBC. It's 8:32. News headlines with Daryl Jackson.
A rail union says removing ticket offices in England is a savage attack on the railway workers, their families and the travelling public. The Rail Delivery Group has announced the plans to cut costs in response to only 12% of passengers using them last year. NHS England's chief executive has praised the constant compassion of its 1.4 million staff as the health service turns 75. But health experts and unions say reform is needed if it's going to bring down waiting lists. And British number one Katie Boulter was among the tennis players whose matches were disrupted at Wimbledon this afternoon. 3 Just Stop Oil protesters invaded Court 18 in 2 separate incidents. LBC weather: clear skies in the east this evening, cloudy in western areas with the odd shower and a low of 4 degrees.
This is LBC. Cross Question with Ian Dale on LBC. Call 0345 6060 973.
8:35, it's a special NHS edition of Cross Question. All of your questions on the NHS or the subject of health policy. We have with us Sir Norman Lamb, former Health Minister, now chairs the South London and Maudsley NHS Mental Health Trust. Dr Kieran Mullen, Conservative MP for Crewe and Nantwich, former A&E doctor. Sarah Gorton is Head of Health for Unison, and Judith Woods is a columnist for the Daily Telegraph. A text question from Alicia in Great Malvern. Striking doctors have admitted they're using the waiting list size employees as leverage to get a pay rise. Should we be angry at them for this? Now, consultants in the BMA who voted to walk out later this month have admitted today that they're using Rishi Sunak's pledge to reduce the NHS waiting list from its current record high as leverage in their demand for a pay increase. Sarah Gorton, let's start with you.
Wonder why you're coming to me first.
Well, I don't know. Are consultants members of your union as well as the BMA?
So Unison, we've got about 500,000 members working in health. All of them do non-medical jobs, so medical and dental outside our scope. And there are very strict conventions about not commenting on the disputes that are run in other sectors and by other unions, which I'm not about to break. What I will say is two things. So one, if you look at the results from that consultants' ballot, whatever your views are, the fact that so many people who from the outside everybody would think are highly paid members of society, do very well, high status, feel so strongly, tells you that something is wrong. So I mean, I think that the failure of government last year to listen to warnings and get into talks early led to this situation of the government's making that now they can't get out of. So I don't really understand why they can't unstick this issue with other groups. I know for the Agenda for Change groups, and in particular the groups of workers that we represented during our dispute in the winter, the constant message was the strikes are because people aren't willing to sit down and talk to us. And as soon as we did get the commitment to sit down and talk, we paused the strikes to start the discussions. The discussions led to an agreement which was put to members, and we ended the dispute with an agreement.
What are the consultants asking for? Remind us.
I've no idea. I don't represent consultants.
It's just that I think a lot of the general public, while they had huge sympathy with your members, with nurses as well, I doubt whether they're going to have a lot of sympathy with people on a six-figure salary.
That may be the case. I mean, the strength of public support for the strikes in, I think most of the listeners will remember ambulance services and nursing strikes earlier this year. But actually, there were more groups than that. We had strikes in physiotherapy services of quite a range of different specialist hospitals covered by strike mandates, and the NHS blood and transplant service as well. And I think the public sympathy was really, I wasn't expecting it to be as strong as it was.
Well, it's going to be interesting to see if it is here. Judith Woods.
Yes. I what can I say? I keep going back to the cause rather than the not the symptom, the cause. And the cause is these highly paid, highly professional people on whom we rely every day are obviously deeply unhappy.
Yeah, that's true.
In a system where they are hamstrung by inefficiency. I could tell you some stories about some surgeons who, they don't have any staff. They don't have anyone managing their workload. They're expected to. That's not the point. The point is that it's come to striking, and you know what? I'm just really tired of everything just coming back to the NHS, and it fosters this idea of it infantilizes us, all of us. Because we rely on the NHS, doctors. I find the whole thing so frustrating. If we paid our doctors properly through a national insurance scheme, we wouldn't have these issues. We do need to pay more.
I think if you set out plans to change the fundamental principles of the NHS, you wouldn't just have doctors striking. And this is the problem. I think the link back to your earlier theme around privatisation is that the danger of talking about ripping up the model and starting again is that it means that people who people who still want to deliver the founding principles of the NHS, so universal systems that are open to everybody, free at the point of need, paid for by taxation, people who believe that, then get forced onto the ground where they feel they have to defend things, rather than do what we should do, which is to be in a constant state of challenge and always looking for ways to improve it. Where I do agree with you is the mawkish treatment of the NHS as if it's something, some holy shibboleth. It is not.
Yeah,
it's a
right.
functioning. It should be a functioning service, and people who go to it for treatment should be treated with dignity and kindness and get good outcomes. People who work in it should be treated fairly and paid well.
Kieran.
So the average salary for a consultant is about £128,000. So I think you're right in saying I'm not sure out of all the challenges on public sector pay, which the government faces, that they're really going to be at the top of the list. My experience when it comes to strikes and what we've seen recently is actually that the biggest thing that NHS staff find frustrating is the rota gaps and the short staffing. I think the important point to make is that there are actually more doctors and more nurses than ever before. It's not that there hasn't been an attempt to really drive up the workforce. We're well on track for the 50,000 extra nurses. There's thousands more doctors. But as I mentioned earlier, demand has increased, and obviously the pandemic just skyrocketed that. So I think what they're saying is, look, we've been frustrated by the short staffing challenges for long enough, and we've had enough. And, it was one thing to recognise we don't get quite paid as much as the private sector and the NHS before, but now on top of it, our work life isn't what we want it to be, so we're just going to not tolerate lower pay either. Not that they get low paid, but potentially comparative pay if they're in the private sector.
But what about the question though?
Yeah, so I think right now,
be angry at them for using waiting lists as a leverage?
What I would say is that it's unfortunate that frustration with them has peaked at a point where the government has got to be very mindful of inflation. And it's all very well to say we should pay them more, but as we know, if we pay all the public sector workers inflation-busting pay increases, then inflation is worse than all the, we're given with one hand to take away with another. And no government wants to do the unpopular thing and say, well, we're not going to pay nurses or doctors as much as they want. They do it because actually there are consequences to that on the public purse and on inflation. I think that my understanding is they do want an inflation-linked pay increase, and I just don't think that's helpful for the economy and for them. As I said, it would set a precedent. It would mean that everyone really should get an inflation-busting pay increase, and if we did that, then we would lose, the money that we gave them through further inflation. And the other thing I want to point out is we talk all the time about public sector pay as if that's the only thing that we can think about when it comes to whether or not it's a good deal to be a public sector worker. You have to remember that NHS staff get a 20% contribution from the taxpayer to their pension pot. That's an enormous amount of money that goes out every year and that you really rarely would get in the private sector. And I think sometimes NHS staff, I think, forget that, don't appreciate what it costs the public.
But Kieran, we do also have to remember that if people have seen their real wages lose value significantly, 20-30% over 10 years or so, there is going to be an anger or a frustration. And, the bottom line is these are highly mobile people, and people will, if we're not careful, vote with their feet. They'll work in Australia and Canada and the States and so forth. And, I fervently believe that the time has come that we need to have some sort of, Sajid Javid called for a Royal Commission. I called back in 2017 for an NHS convention. We need a national conversation about a new settlement for the NHS and critically for the social care system. And that has to involve a sustainable system that ensures that people can be retained in the workforce, people feel happy and want to be there, and are paid a wage that is attractive to retain them.
No, I understand that. I don't think that whilst there is an issue with some staff leaving, I don't think that pay is the primary driver of that. It's working conditions, and I think the primary answer to that is increasing the size of the workforce. And if I'm in the government and I've got £1 that I can only spend once, I think the money needs to be concentrated on growing the workforce. That in the long run, that's what will make NHS staff feel better about their work life.
I certainly agree that we have to grow the workforce, and I welcome the long-term plan,
which is really groundbreaking. Something that I wonder if Jeremy Hunt, as chair of the Health Select Committee, recommended it. He ended up as Chancellor, and it was probably a Treasury issue committing.
Yeah,
to
I'm quite sure he thought that through.
Yeah, and it will make a huge
get some resistance.
But one of the main elements of it, you set out 3 main aims, and the second one is retention. And unless you start using the pay and reward package strategically, then you know that is not going to be met. And you know it's really good that we've got a baseline now, and that we've got plans to start reinvesting in numbers in terms of the people who are trained, not just to work in the NHS, but in pharmacy and dentistry and different aspects of health provision. But that will take time, won't it?
Yes.
And in the meantime, the priority has to be the actions to stop more people leaving.
Yeah, but as I said, that's balanced up against this inflation challenge. I think the public do understand that, and I think they want to pay them more. But what's the point if you just drive up inflation?
The big question that we all want to know the answer to comes from an anonymous Alexa message. Ian, what do you get paid just for talking?
Well, come on, Ian, answer the question. Transparency.
Mind your own business. I don't get paid by the taxpayer. That's the difference. So,
Fair point.
Right, we'll move on to something else very quickly in just a moment. It's 8:47.
LBC. Leading Britain's conversation. Cross Question with Ian Dale. Alexa, send a comment to LBC.
It's 8:49. Sir Norman Lamb, Dr. Kieran Mullen, Sarah Gorton and Judith Woods with us taking your calls. Tony's in Castleford. Hello, Tony.
Hello, Ian. Welcome
Hi.
back.
Thank you. What would you like to say?
I'd like to know the panel's thoughts on how can we make the NHS integrate and work better with the social care sector, given that many people within the sector, Norman Lamb himself tonight mentioning it, agree that without a fully functioning, well-resourced social care sector integrated well with the NHS, we're not going to see any improvements in the NHS at all.
Kieran, let's start with you on this, because I think this is a really interesting point
Yes.
that Tony's making, because how can it be fully integrated when social care is largely run by local authorities?
And not just that one, you have one funded by a model of general taxation and one funded by a mix of local taxation, national taxation and people paying themselves. I think one of the... I was very welcoming of the reforms to social care that were due to be brought in. I think it's really unfortunate.
Then we abandoned them.
I understand the pandemic really meant that was a real difficulty, and it was actually feedback from the local authorities, my understanding, and and the social care sector, that in the middle of all those acute challenges that the pandemic had created, for local authorities to have to introduce a whole new way of doing things was too much of a stretch. But I do hope we stay on track with them. And that was a seminal achievement, to at least come up with a plan, put it through Parliament, have it be voted on, sadly voted against by both Labour and the Liberal Democrats. No other government, though this is an old problem, had actually put pen to paper, agreed a plan and put it to a vote. And I hope we can go back to that plan and deliver at least some fairness in
But
the
Kieran,
resources.
Then your party in government abandoned it.
So yeah, as I said, the feedback
Disaster.
from the Liberal Democrats voted against it. Labour voted against it.
Yeah, I disagreed with them on that.
I think it was genuine feedback from the local authority sector. It represents a major change in how they would have to interact with people.
We need more money
So I
going
think
into social care.
it
But the
would have
fact
been
that Jeremy
challenge.
Hunt is Chancellor, the fact that he was Health Secretary for so long, and the fact that he said his biggest mistake as Health Secretary was not progressing on social care, I mean,
Yeah.
that surely has to give you some hope that something might happen.
Well, I really hope so. I mean, when I was Minister, I legislated to introduce the cap on social care costs. And as soon as the Conservatives had got rid of us out of the coalition, they abandoned it. It was due to come in 2016, and that would have capped everybody's care costs, and it would have stopped people suffering catastrophic loss as a result of getting dementia or something like that. Then Boris Johnson announced that it was going to be reintroduced, and then it's been abandoned again. And let's just do it, and let's be prepared as a society to invest more in social care. You know, we talk about wages in the health service. It's social care where there's the real problem. Many people on poverty wages, too often not getting paid for travel time between houses they visit and so forth. That's the real scandal, and it's a bad reflection on our society that we don't value people working in care more than we do.
Did you really just say when the Conservatives got rid of us out of the coalition?
I did.
It's an interesting interpretation of the
I'm sure
2015
they were
election.
delighted to remove us.
Mutual parting of ways.
To go back to the general topic here of the NHS suffers from multiple bottlenecks. Bottlenecks where you could only see a specialist if you go through your GP, a bottleneck where you have to go through a certain process to get out of hospital even though they desperately need your bed. And I agree with what you've said, Norman, about we have to be bolder. Whatever happens, there has to be some kind of room for innovation and not, well, we could, but on the other hand, I think fortune favours the brave.
Yeah, totally.
And we just need to remember the human beings at the centre of all of this. That for every time we talk about, care system, these will be us soon. In fact, let's forget about it. That'll be us.
Well, I think there has been some boldness. I think if you look at the integrated care boards now, so there's a genuine attempt to organise health and social care together. There are models where we ask the NHS to spend social care monies. Actually, some of those silos, actually, rather than getting social care to come and do things for the NHS so they can get people out of the hospital, we give the money to the NHS to spend on getting people out of hospital. So there are examples of it.
And I do think so. Greater Manchester, where Andy Burnham, I think, has done really well in bringing health and social care together. I chair a Health Devolution Commission jointly with Andy Burnham. And I think part of it is that the NHS is far too centralised, and if we devolve power to the local area, then you could really see NHS and social care working
But the
more
real
closely
barrier
together.
to that, though, is that people look over at what's happened to social care and they see the experience that their parents and their relatives are having in social care, and they go, I don't want the NHS to get that bad. So I think there's an extent to which your point about being bold needs to be looked at in context of social care. And I appreciate what you're saying about, integrated care boards, trying to put patchwork, and stitching in to make these things work functionally. But actually social care has never been set up to work in that functional way. It's not just a case of poor pay rates. There's no contractual security for people working in that sector, completely dependent on getting skills in, importing skills in order to prop that sector up. So we just need to have a proper look at it. And what was really interesting in all of the many and various public polls this week around the health service, there was also really strong support for a proper look at social care, which does give us some hope for the future, and it's why Unison's strongly supportive of creating that sort of consistent care service where people can expect to be treated with dignity by people who've got consistent standards of training and qualification, as well as being fairly rewarded.
I want to get one more question in. Tony, thank you very much for that. Kevin in West Oxfordshire has texted this. I suffered a heart attack last December and was treated over 7 days at the John Radcliffe Hospital in Oxford. The staff, doctors, nurses and nursing assistants were unendingly good to me. I would say about 80% of the staff were foreign nationals, so without them our NHS would collapse. Does our current migration system therefore render the NHS a public service which is not fit for purpose? Well, that's an interesting one. Because I think the official figures show that 22% of NHS employees come from outside this country. When I was in St Thomas's, I would say the overwhelming majority of the staff there, whether they were doctors and nurses or ancillary staff, were not from this country. I did think to myself, how could this hospital exist if we didn't encourage people to come from other countries? But then you have the ethical dilemma.
Absolutely.
Is it really? Should we really be doing this?
Yes.
Sarah?
Well, the NHS has always, it's Windrush, time as well as remembering the founding of the NHS. So the contribution of workers from overseas has always been recognised, will always be a part of the NHS, but it's that over-reliance that has become an issue. And the ethical dilemma is, as you say, potentially denuding trained health professionals from other places around the world. But we are part of a global health system as well, and need to recognise that. But growing the domestic workforce has to be a priority. Investment in apprentices. We know there are loads of people working in more junior care jobs who want to be,
But that's why that workforce plan is so important. That workforce plan is aimed at tackling this issue, so it's homegrown staff. Because I agree, it's a real challenge to know that someone's trained somewhere else, paid for by another country for their training, and they come and work for us. Though I understand in some countries they kind of plan for that. People pay to get trained on understanding they'll go work.
And they regard it as an export earning.
Yes.
Philippines is...
Yeah, exactly. Yeah. But ideally we should be, not just because it's good for the NHS, but it's good for the British public. We want the British public to be doing these high-skilled jobs. It's careers that are not going to disappear anytime soon. Hands-on care is a job that will be around for a long time.
Norman?
Yeah, I really want our organisation to be bringing in loads of local people, amazing diverse population into our organisation through apprenticeships and growing to become nurses and even to become doctors. And I welcome the route that will be provided now to be able to become ultimately a doctor through that apprenticeship route.
Judith?
Yes, I may be wrong on this, but is it still the case that nurses have to do a university degree?
Yeah, but you could do it through an apprenticeship route.
Well, I think that's certainly to be welcomed, because I know an awful lot of people are completely put off that, who have all the right skills, the right mindset and the right abilities, and they're put off by the idea of having to go to university when we could get them on the wards in 6 months. And they could learn on the job. So in that sense, I wouldn't be at all churlish.
Right, final text question from Julian Burnley. What's your favourite medical drama?
Holby City. Tuesdays will never be the same.
That's gone as well.
I know.
Yeah.
Just like you said in the break, I hate them all. I spend too much of my time thinking about health and I don't want to watch medical dramas.
I go for escapism every time. I go for Grey's Anatomy.
I don't really watch her anymore, but when I was growing up, I was obsessed with Dr. Quinn, Medicine Woman. I don't know if anyone remembers that.
I don't think that was the medicine. I think it was more Dr. Quinn.
That wasn't Dr. Quinn appealing. I back up the other trade.
I will nominate Scrubs, which I think is one of the funniest programmes I've ever seen. Thank you so much to all of you. Really, really good discussion. To Sarah Gorton, Judith Woods, Kieran Mullen and Sir Norman Lamb. Coming up in the next hour, we're going to talk about the government's plan to shut virtually every ticket office in railway stations stations throughout the country. Only 12% of us now use ticket offices to buy a ticket. 20 years ago, it was 82%. So clearly, you could argue that is an argument on its own for closing them. But the rail unions are not very gruntled at this development, as you can imagine. So I want to ask you whether you think the government's right to do this, or are they using a sort of sledgehammer to crack a nut? Should they be consulting more? They've apparently ripped up an agreement with the trade unions that they came to